Using exercise bands for hip strengthening. The type of band you use, as well as the amount of tension in each band, is dependent upon which one you buy and where you buy it. Each color has a different level of resistance, so you have to experiment with which one is best for you to start. Yellow tends to be some of the lightest, whereas black seems to be one of the strongest. They need to provide enough resistance to give you a challenge, but not so much that cause excessive pain or you can't even do the exercise. I've seen these at dollar stores, at sporting goods stores, as well as you can buy them online. You can also get advice from a certified fitness trainer as well as a physical therapist. Now take the exercise band and wrap it around your knees. A more challenging situation is wrapping it around your ankles that you see in the upper corner. The lower it is on your leg, the more challenging it will be to strengthening up your hips. Here I've placed the bottom portion of the band just above my knee. Now we do deliberate controlled steps with the resistance band. It has to be enough tension to give it a challenge. And I lift my foot off the floor and then step forward, step to the middle, sometimes swing backwards. After several repetitions of this movement, say 5 to 10, then you switch to the other side and repeat. Now with your feet separated so there's a little tension in the band, do a little squat and push your knees outward. Just bend your knees outward as shown. To be a bit more challenging, see the squat in the upper right hand corner. This does help teach how to do a good squat. Now we start doing side steps. Keeping tension on the band, we sidestep to the left, then we sidestep to the right. Keep going back and forth for at least 30 seconds. Next, we transition to monster walks, keeping tension on the band while taking giant steps forward and backwards. And do this for at least 30 seconds. Place your hand on the kitchen counter and then go backwards. Don't just avoid not doing it because it's hard. Figure out how you can train yourself to improve your balance. Now we're going to work on the hip adductors, which are the groin muscles. I'm using 2 kettlebells so that I can get the resistance I need and the stretch on the band. You may want to put this around a heavy chair, a couch, or a table. The starting position should have a little bit of tension in the band. Then you swing your foot so that it comes in front of the standing foot, and then you swing it behind your standing foot. After 5 or 10 repetitions, you switch. Now here's an example of advanced hip exercises. The challenge is several-fold. First, we're going to focus on minimally putting the foot on the floor. We'll be swinging it back and forth, moving the foot in an arcing motion, as well as swinging it from back to front and front to back without putting the foot on the floor, except for occasional stability. After about 30 seconds to a minute of doing this, then we keep the TheraBand ankle stable, and then you start twisting our bodies over the standing leg. This not only challenges and exercises balance, but also exercises the small internal and external rotator muscles deep in the hip. Frame, as well as the amount of pain and discomfort you're in. Now we get into using resistance bands to strengthen up the shoulder. TheraBands is a resistance band that is used commonly in the physical therapy clinics. And the ticker demonstrates how the colors associated with resistance. You can experiment with which resistance to start with, or you can ask a physical therapist or a fitness trainer. Now there are other brands of resistance bands and resistance tubes out there that you can purchase as well, and they too will have some form of color scheme. So I'm just giving you an example that there are color schemes with these resistance bands. Usually these TheraBands are wrapped around a door handle, but because my filming studio does not have a door, I've improvised here. So once you get the band secured, you then step far enough away that there's some resistance on the band initially, and now you start doing movement exercises. Here, I'm strengthening up the internal rotators, which is called the subscapularis. I consider this the core muscle of the shoulder because not only is it a shoulder blade or a scapularis stabilizer, it also is considered a rotator cuff muscle. It's important for you to keep your elbow and forearm at 90 degrees and the elbow next to your body for maximal benefit. Now we transition into a shoulder complex exercise. This doesn't exercise a singular muscle, but it works the shoulder complex as a whole. This is also a kinetic chain core exercise, so therefore I put my opposite foot forward and I want to stabilize my entire body as I do this exercise. I don't want to have a resistance band that's so heavy that I have to hike my shoulder up in order to do this exercise. Now we transition to the third shoulder exercise where we turn and face the resistance band, and now we pull backwards. This also is a shoulder complex exercise, but in the opposite direction. We now rotate our body 90 degrees, and we now focus on rotator cuff strengthening. As with all these exercises, the elbow needs to be held close to the side in order to maximize the focus on the shoulder muscles. When we're done here, we can then switch hands in the TheraBand and start all over again. Here is a subscapularis muscle. Next is the shoulder complex strengthening exercise, phase 1. Remember, you want to put the opposite foot forward to increase the challenge of your core strengthening and your kinetic chain stabilization. Next, we move to shoulder complex core strengthening, phase 2. Remember, put the opposite foot forward in order to also challenge your kinetic chain. Notice how I keep my elbow close to my side, and that's important in all these exercises, that the elbow stays close to your side. And now we transition to rotator cuff strengthening. In particular, these are strengthening the infraspinatus and the teres minor muscle. We'll get to the supraspinatus, which is another rotator cuff muscle, in just a moment. Now we're going to show you how to use the resistance bands without needing a door frame. You actually can just use your foot. This is a cross-body exercise, so this is going to be focusing on the supraspinatus muscle of the rotator cuff, but it's also a core stability exercise as well. Now I have you switch sides and you'll do the opposite shoulder in order to improve also the rotator cuff strengthening and core stability. Now we're going to return to the side that we started the rotator cuff strengthening and start doing an overhead press. This also works a number of muscles of the shoulder, not just one. There's also a little bit of core stability because you have to stabilize your whole body while doing this move. Now we switch and do the other side of the shoulder complex overhead press. Next, we transition to the lateral raise. Raise it up as high as you are able to. Next, we transition to the shoulder complex posterior pull. Now we switch sides one last time and do lateral raise. Now we transition to the shoulder complex posterior pull. You can buy resistance bands at dollar stores, online. I've noticed that in some dollar stores they have a lot of exercise equipment for $5 or less. Usually it's on the lighter end of resistance, not heavy weights, but they can work just as well. So be creative. While you are becoming familiar with this sequence, pause the video to practice each activity. Eventually, you will not need this video in order to do this sequence. The approach to these mobility sequences is to demonstrate activities that can be done throughout the day. The more you can find ways to incorporate this sequence into your daily life, the more benefit you will find. Fitness is a daily lifestyle that can be improved with small steps throughout the day.